Well, June is National Migraine and Headache Awareness Month.
Migraines affect more than 40 million people in the United States, and they are the #2 cause of disability worldwide. Dr. Ala Abdel Saeed is a professor of anesthesiology at UW Health and the medical director of the UW Health Pain Management Clinic. Dr. Ala, good to see you. Welcome back to Live at 4.
Good to see you again virtually.
Yes, well, soon you'll be back in the studio.
I can't wait for it.
This is a pervasive problem. What is the difference between a headache and a migraine?
So there are several types of headaches. Migraine is probably the one I would say we hear about more. It's more popular. But there are two other big types of headache, like tension headache. So migraine headache basically is this acute episode that happens usually one side of the head. Can be on both sides, but usually on one side. It can be associated with other symptoms, can be preceded and actually followed by other also neurological symptoms. The tension headache is the headache that takes all around the head like in a band, like lasts for longer durations, more chronic, happens more days. And the cluster headache is the headache that's more localized around the eye region, causing congestion, watering of the eye. So these are the biggest three classes of headache, and there are many other types of headaches.
Well, do we know what causes migraines?
Can you repeat the question?
Do we know what causes migraine headaches?
It's not totally understood, but there are several mechanisms that propose that hyperexcitability of the brain, abnormalities of pain pathways can cause those attacks.
Can stress bring them on?
Stress and anxiety are two big ones to cause migraine headaches.
So how do we treat them? What can you do about them?
There are several ways to treat them, as we always like to start with non-invasive methods or non-pharmacological methods. For example, avoiding triggers if we know there are triggers that bring on the headaches. Cognitive behavioral therapy, reducing the stress and anxiety. If those measures do not work, then we start with medications. And there are several types of medications. Some of them are used, we call them preventive. So they are used on chronic basis. Patients take them on daily basis to avoid the occurrence of the headache. And there are abortive and rescue medications, which the patient can take when the headache occurs. Try to abort the headache so it doesn't keep going and be severe. And then we have the botulinum toxin A injections to follow if medications do not work. Also, we have a procedure we noveled here at UW, where we do nerve blocks and radiofrequency ablation of certain nerves to block the transmission and reduce the headache intensity and the frequency. And, at the end, there are implantable devices and surgical interventions to treat the headache for patients who are resistant to everything I just mentioned.
Do you ever use light therapy with migraines?
Yes, it can be used with migraines. As I mentioned, there are many triggers also for migraines that we need to avoid, and light therapy has been used. Many other therapies that are non-pharmacologic has been proven to be effective.
Well, June being Migraine Awareness and Headache Month, it's a good time to take a look at this and talk to your doctor if you're having problems.
I agree. Headache is very disabling. I see a lot of patients in headache, and it's very disabling and can cause many consequences of depression, lack of social life, and can impact work and cause disability. So definitely treatment is very important.
Absolutely.
Dr. Abdel Saeed, great to see you. Thank you so much for joining us today. We'll see you again soon.
Again, thanks for having me, and hopefully to see you soon in person.
All right. Absolutely, doctor. Thank you.